If you're a UK trainee pharmacist sitting the GPhC exam this year, then listen carefully. This exam does not reward luck. It rewards structure, repetition, and strategy. And in the next few minutes, I'm going to give you the exact framework that helps trainees pass every time. Hey, I'm George, a UK hospital pharmacist. And on this channel and my GB Pharmacist Instagram channel, I help trainees pass the exams, secure job roles, and transfer confidently into qualified practice life. So without further ado, let's dive into my top 5 tips. Tip 1, learn the exam before you learn the content. Most trainees revise topics, which is fundamental, but the strongest candidates learn the structure of the exam also. The GPhC exam is seated with competency-based questions. They are not accessing your extensive memory. It tests application of knowledge, the prioritization of scenarios, and safe clinical decision-making practices. Every question maps back to the assessment framework set out by the General Pharmaceutical Council. So reviewing that and looking at that is fundamental to exam success. The key areas that you will always be tested on no matter what year is around your clinical judgment, legal and ethical decision-making, calculations done under pressure, and risk management and patient safety. So what do I mean when I am talking around learning the exam ahead of the content? For example, when revising anticoagulation, don't just memorize the doses, don't memorize dosages. Instead, practice how you handle anticoagulation in certain situations, such as when there's missed dosages, in renal impairment, when there's a bleeding risk, ahead of surgery, and any potential drug interactions. This allows you to really apply the knowledge in an actionable way, which you will be assessed on. If your revision doesn't mirror the GPhC framework and what the GPhC expect, you are revising inefficiently. And as they say, time is money. Tip number 2, past papers are a non-negotiable. Now let me be blunt. If you're not actively using past papers in your revision and preparation, you are gambling. But also understand that if you are doing past papers without the analysis of the output, you are wasting an element of effort. Some trainings go wrong by sitting a past paper, marking it, then forgetting about it. What you should do instead, after every past paper that you do, review it and analyze it. Make a mistake log with 4 columns. The topic that the mistake was made under, the error type, was it knowledge, was it interpretation, did you misread the question, which is another top tip, RTFQ, was it a calculation issue, or was it simple pressure? Did you run out of time? Then log why you got it wrong and what rule or action can you put in place to prevent it occurring again. Doing this time after time, you will develop a smaller and smaller mistake log and you'll be better prepared come exam day. For example, if renal dosing was an issue in one of your past papers, revise the renal logic, not the drugs. They are infinite. You can't revise every single drug, but revising the knowledge, you can apply the general rules of multiple drugs. If legal questions were an issue, revise the principles rather than specific legislation lists. And if you're still on the fence about using past papers, here is why past papers matter. As per tip 1, they help you understand the exam structure and expectations, and they train you to recognize patterns and as the same themes run throughout all GPhC exams, whether that is 10 years ago or that is this year, as the GPhC exam is a standardization test. Also, by using past papers, you will understand that there is repeated themes such as antimicrobials, anticoagulation, controlled drugs, safeguarding. This list is non-exhaustive. And by using past papers, it also reveals how the GPhC phrase questions and even down to some of the traps that they use, i.e. those double negative worded questions. So how to use past papers effectively. Sit them in a time setting, mark them and understand why each answer is wrong, and log the errors as a weakness tracker so you can focus your revision in a specific manner, increasing the efficiency of your time. To help with all of this, and I know access to some past papers is an issue, I have created some of my own past papers and linked them in the description below. So don't wait to feel ready, use the past papers to increase that confidence and allow you to be the most confident come exam day. Remember, readiness comes after repeated exposure, and past papers are a great way of doing this. Tip number 3 is the calculations, and they are 3 marks if you train them right. Yes, calculations can be stressful, especially if you haven't trained them, but calculations are where exams are passed or failed. On exam day, you're expected to be accurate, calm, and confident. Errors usually come from unit conversion issues, rushing, or poor approach in your structure to answering them. Nailing calculations is binary. You either get them right or you get them wrong. And if you get them wrong, you can learn how to get them right. Seek help if you need to, and go through this approach until you know how to do them all. Treat it like the gym. 15-20 minutes a day, build that muscle memory in approaching calculations. And like the gym, you can set yourself a plan. Maybe doing 5 concentration questions a day, maybe adding in 5 infusion or rate questions, and then ensuring you're covering the renal and weight-based questions. No calculation shortcuts, just repetition so you can increase your efficiency and accuracy in dealing with calculations in the exam setting. Confidence on calculations is a cheat code in exams. It reduces your anxiety across the entire paper. And the aim here is that by the time you get to the exam, you have 0 adrenaline spikes when you see a calculation question. Tip number 4, use official support. Do not struggle in silence. The trainee year is demanding, clinically, mentally, emotionally. You are not expected to do this alone. Your employer is there to support you. You can even reach out to a university to support you, and they may even have courses and resources to help you excel in your pre-reg year. At the end of the day, the universities, even though you've graduated, do have skin in the game, as they can quote how many of their students were successful in passing the GPhC exam, which they can use to market the new cohort coming through. I.e., no one wants to go to a university that has a 0% GPhC pass rate, where everyone would want to go to one that has a 100% GPhC pass rate. So always reach out to them if you need to. But if not, then you can seek other formal help. This is in relation to exam preparation and pharmacy-specific help, but also your general well-being. So keep checking in with yourself. It's a long year, it's an intense year, and getting support is not a weakness. In fact, it shows self-awareness and professional and self-risk assessment. Strong pharmacists ask for help and support early, and struggling in silence helps absolutely no one, and can only exponentiate the underlying issues, creating a snowball effect that culminates in a negative outcome. Tip number 5, revise like a qualified pharmacist. Hate to